Hello, everybody. Thank you all very much for coming. It's my pleasure to welcome you to our webinar, Our Prostate Cancer Journeys, Empowering Partners of People with Prostate Cancer. This webinar series is a collaborative project between ourselves, Prostate Cancer Research, and the pharmaceutical company Ipsen. My name is Dr. Sarah Nelson, and I am the Health Information Manager of Prostate Cancer Research. So I'm just going to run through today's agenda. And we're joined today by four wonderful speakers. Dr. Terry Gillese, a therapeutic radiographer, is going to talk to us about her study, A Problem Shared, A Problem Hard, the Female Experience of Prostate Cancer. And Caroline Prance, the co-leader of the National Prostate Cancer Partner Support Group and member of the Oxfordshire Prostate Cancer Partner Support Group. And Joanne Marston is member of the Friends and Brethren's Prostate Cancer Support Group. And both Caroline and Joanne will be joining me for a discussion about their experience as partners of people with prostate cancer. And a final speaker is Angela Gregory, psychosexual counsellor at Nottingham University Hospital NHS Trust. And she'll be talking to us about the impact of prostate cancer on partners, a psychosexual perspective. So first of all, it's my pleasure now to hand over to Dr. Terry Gillese for her presentation, A Problem Shared, A Problem Hard, the Female Experience of Prostate Cancer.
Thanks for letting me come along and speak today about the study that I have done. So really what we wanted to do in this study was to find out what female experiences were in relation to prostate cancer, and whether there was already any support out there for them, and if there was support, to find out whether it was useful for the female partners. If you could just move on, please. So really, according to Prostate Cancer UK, there's around 400,000 men in the UK living with prostate cancer, living beyond prostate cancer. And if we extrapolate from the statistics from the Office of National Statistics, that means that there's around 225,000 female partners who have had their relationships touched by prostate cancer. Now, apologies if there's any same-sex partners out there, and we do know that you are going through this journey as well, but we have focused specifically on female partners in this study because of the greater number, and also because previous research indicates that same-sex partners have different issues from female partners. Next slide, please. So there have been some previous research studies that gathered information from partners, but in this previous research, the men had to agree to women taking part in the research and or invite the women to take part. So we felt that there might be some bias in these studies, particularly if the men were having a hard time or if the relationship was having a hard time. So we wanted to recruit women independently. And so we advertised through social media, newspapers, etc., to get these participants. And the study took the form of interviews, and it took place between the November 2017 and August 2020. So a few years ago now, but not really that long ago. The women that took part were able to choose where they wanted the interview to take place. So they were really very comfortable with the interview. And there were face-to-face interviews except for the last two, because that was in the middle of COVID, and they took place via Zoom. The participants were free to talk about what they wanted to talk about and what they felt were issues, rather than me asking them specific questions. Next slide, please. The people that took part in this, the men had been diagnosed between the year 2000 and 2018, and the age range of the men at the time of diagnosis was 47 to 74 years old. The women at the time of the men's diagnosis were between 28 and 70 years old, and the length of relationship was between 3 and 60 years. So really a wide cross-section of participants and participant experiences were gathered, even though we only interviewed 26 women. Next slide, please. So the first thing that really struck me was that 9 out of the 26 participants, without any prompting whatsoever, said that this was the first time that anyone, family, friends, healthcare professionals, or anybody, had ever asked them how they specifically were dealing with their partner's prostate cancer diagnosis. The participants talked about things that could be seen as generic issues that could relate to really any cancer or any sort of chronic ill health. And some of them talked about specific problems that were related to the particular trust that they were treated in. Some also talked about individual patient complications. And a lot of issues obviously were explicit to prostate cancer. Next slide, please. So the women frequently reported feeling excluded or ignored by healthcare professionals. For example, healthcare professionals were very reticent to invite them into consultations. And if they were in the consultations, then the healthcare professionals really spoke directly to the man and ignored the woman during the consultation. Now, women recognised that it was the man that was the patient, but they wanted and needed to be included. Next slide, please. As Una says here, she really had to ask to go into the consultations as well, even though it was clear that her partner had invited her along. She felt very much that the surgeon ignored her completely. And although the nurse, as you can see in this example here, was much more welcoming to her, she really felt that she was being a bit of a nuisance to the nurse and really shouldn't be asking all the questions that she was asking. So she felt that she really had to sort of just stay quiet and let the nurse get on with the work. Next slide, please. And yet at other times, healthcare team really relied on women to take care of the men and to be involved in the men's care, and particularly men who had a prostatectomy. So as some of you will be aware, men were discharged home with catheters, but there was no information provided to the women very often on how to manage care, how to empty catheter bags, or even given information on how long the catheter would be in situ. Products such as catheter bag stands and incontinence products weren't always provided or even discussed with the women. Some women were lucky in that they had friends or relatives that were able to give them advice. And for example, Susan here said she had a friend who'd already told her she'd need a nightstand because that friend had looked after her mother. So she was lent a nightstand for the prostate, for the catheter bag. Next slide, please. So women needed information on resources on how, when, where, and what products would be needed. And they needed this information before their partners went into hospital, because as you can imagine, whenever the partner was in hospital or just come out of hospital, things were really very busy. And they also talked about the fact that getting products meant negotiating between primary and secondary care. So there were delays in getting the things that they needed, and they had to have multiple appointments to deal with a single issue. As Ursula says here, you can go and see a nurse specialist, but then you have to go back to your GP for a prescription. Now, we know that there are non-medical prescribers that are seeing, we're seeing more of those in the health service these days, but still quite a lot of things you have to go back to your GP for a prescription for. Next slide, please. Now, one of the participants, Yvette, had experience as a nursing assistant, and that meant she had more of an idea how to look after her partner than other people did. And as she said here, she got a few pads from the hospital, but she had to buy the rest. And the best thing she thought was that she'd bought him a urine bottle, because he had difficulty getting upstairs to their only toilet immediately after the surgery, and she had to return to work straight away because she was only 28 at the time, and with her husband losing, or with her partner losing his income, they really needed her income. But very few people had her professional experience, and they talked about encountering delays in finding the right products. As Zia said here, he found out afterwards that if he'd got a penis pump, that would have helped. But they went back and forward between various people trying to get a penis pump. And then eventually the GP said that wasn't allowed. And they did buy one privately, but they felt that they very much missed the optimum time to use that penis pump because no one had told them ahead of time that they should really be looking for one of these. Next slide, please. So there seemed to be universal agreement amongst the participants that there was missing or inaccurate information on who to contact if problems arose, or when someone should be contacted. Neither Trish nor Steve, that I've mentioned here, ever had surgery before, and the level of pain that he should experience wasn't clearly explained ahead of time. So that led to a delay in getting intervention for complications that he experienced. As she says here, he was in an awful lot of pain, but they didn't know that that wasn't really normal after surgery. Next slide, please. And Yvette explains here some of the difficulties in trying to contact someone for assistance or advice. As she says, you only ever left a message, and then somebody would go through the messages once a day and phone you back. And if you couldn't pick up the phone, that was it. You went back to square one, and you had to phone again and leave the message all over again and hope that you were somewhere with reception when they phoned you back. As she says, it's not a criticism of an individual, it's just the way the system worked. But you could never get information very quickly, and you never got the same nurse calling back. Next slide, please. While there were some support services available, such as Macmillan and Maggie's, that the partners could access, they didn't actually realise that these services were for them because of the wording on the websites and the literature, because they used the term carer, and these women didn't really see themselves as a carer. They thought carer meant looking after loved ones who were at the end of life stage pathway. So the support organisation's choice of the word carer really rendered these services invisible to most of the participants in this study, certainly. Next slide, please. But women raised problems in relation to their own healthcare too. 6 women in this study realised that they were having problems and not really dealing very well with their prostate or with their partner's prostate cancer, and they approached their own GP for help. One was offered counselling straight away, which she found very helpful, but 5 were immediately prescribed antidepressants. One woman thought the medication might be useful, but 4 others really didn't feel that it was going to address the root of their problems, so they refused the script. 3 of them, of those 4, then opted to pay for private counselling because it was the only way they could get any counselling. One unfortunately couldn't afford to pay for private counselling, so she was left with no support until she took part in the study, when we were able to source some charity counselling on her behalf. Next slide, please. So the prostate cancer journey was really a balancing act for women, as they described it, a balance between taking the lead in terms of helping the man to get diagnosed, researching treatment options that they could discuss, and promoting aftercare, and balancing that with respecting his masculinity and autonomy and privacy. Next slide, please. So one of the most common side effects, obviously, of prostate cancer is erectile dysfunction. And the women recognised really the stigma of this impotence and the need for the man's privacy. And they actually often put maintaining a silence ahead of their own need for support. As Karen says here, she has no one to talk to about it. She wouldn't want to discuss it with friends because that's Paul's dignity. Next slide, please. So the women in this study were most often the person in the couple who recognised the symptoms of prostate cancer, or at least recognised that there was something not quite right with their partner, and encouraged, or I suppose maybe nagged the man to go to the GP. They were also the ones who ensured that men followed the post-treatment healthcare advice for things like doing Kegel exercises and eating healthily. And they were frequently the impetus behind men attending prostate cancer support groups. Next slide, please. But a recurring theme was really women losing themselves in supporting their partner. Next slide, please. The losses really were felt in multiple dimensions of the women's lives. The loss of physical and emotional connections, as you may well expect. And as Louise explains here, even where sexual relationships were no longer a big part of the women's lives, she felt real physical loss and physical isolation when her husband decided that he would move into the spare bedroom. And she believes this was because of urinary incontinence, but he didn't even discuss that with her. And as well as that physical loss of him not being in the room, she also felt a huge emotional impact from it too. Next slide, please. Karen was one of the younger participants in the study whenever her husband Paul was diagnosed. And she really missed the physical relationship acutely because they had used that as a way to repair their disagreements. And as she says here, no matter if it was 1 or 2 in the morning, that was how they made up. So she found that very, very difficult, and very difficult to have an ongoing emotional relationship as well as an ongoing physical relationship with her husband. Next slide, please. Some men specifically asked women not to disclose their prostate cancer diagnosis, or else they would choose the few people who could know about the diagnosis. But these people weren't always the people that women would talk to about things. So the women couldn't rely on their usual support network, and it put them in a very isolated and difficult position, as Rose explains here. She sort of felt like she went behind her husband's back to talk to someone because she really needed that support. And as she says here, so I'm not supposed to tell people. I've told one person that I haven't told him about. But now Rose feels really guilty and disloyal. And she's very concerned about her friendship with this other lady because she thinks that her friend will act differently towards Mike. Next slide, please. Karen, who I've mentioned a couple of times before, was a nurse and a midwife, and so she thought that her colleagues would understand some of the difficulties that she was going through. So she did talk to her colleagues at work, and as she says here, I think maybe I discussed it a couple of times. In fact, I acutely remember somebody being really insensitive at work, going, "Oh, that's a disease where you can't have sex." So that avenue that she thought might be support for her really turned out not to be support for her. Next slide, please. Women also talked about the loss of role in work and at home. Some men had taken retirement or left work due to illness related to their prostate cancer. And some men actually expected or asked partners to leave work as well to be with them. In some cases, that was the opposite was true, while some women then had to increase their work patterns because of financial pressures due to the man not being able to work. They also found that they had to take on additional tasks at home that were previously shared. So their lives had changed in a number of different ways. Next slide, please. So women were really discussing the dichotomy of loss in survivorship. They still had their husbands or partners, but they were experiencing significant changes in their relationships. They were experiencing ongoing side effects from the treatment. And they were dealing with a chronic condition really over a very long trajectory. Some of these men had been diagnosed nearly 20 years before we did this study, and they had to adjust to differences in their lifestyle. Next slide, please. And I talked about the healthcare professionals excluding women, but sometimes men excluded their female partners as well. As you can see here, George had told Jill that he wasn't going to the doctors or even having biopsies. He told her he was going away. And the first Jill ever knew of his diagnosis was when he had the choices of various types of treatment. He really thought that he was protecting her, but in turn, Jill actually felt hurt and excluded by him doing that. Next slide, please. Women also felt the burden of societal expectations on them, and they felt external pressures to adhere to the traditional female roles. Women as carers, they felt they couldn't be seen to be disagreeing or arguing with someone who's unwell. They felt that they had to focus really on the person with cancer and that they shouldn't be thinking about themselves at all. Next slide, please. But they did often describe some positives to come out of the prostate cancer diagnosis. As Denise explains here, she certainly felt that the hormone treatment made Gary less aggressive and less angry, so she did see that as a positive. Next slide, please. And as Nora explains here, they made the most of every opportunity, even going on back-to-back holidays, as you can see here, and as well as making new memories. She also got involved with some voluntary work at the National Cancer Charity Experience Panel and a bereavement support charity as well. Next slide, please. So in conclusion, all the women in the study did describe their lives as being impacted by men having prostate cancer to at least some degree. The impact was felt on multiple aspects of their lives, not just the physical intimacy, as some previous studies would indicate. The use of the term carer in literature really prevented some women from utilising the support services that were out there, and the need for men's privacy really prevented some of them from getting the support that they needed. We did find that women whose partners attended prostate cancer support groups really adjusted better to life after prostate cancer. We also find that gender differences mean that the male and the female part of the couple need different types of support. Women do appear to benefit from female support groups. Unfortunately, currently, certainly at the time we did this study, these support groups seem to be offshoots of male prostate cancer support groups. So women whose partners didn't go to those groups didn't have that sort of support. And women do need to be informed and included by both men and the healthcare team. Next slide, please. So is a problem shared, a problem halved? Well, although prostate cancer is often dubbed a couple's disease, women do often need another female to share their journey with. Thank you.
Thank you, Terry. That was really interesting and very insightful. So thank you very much for that. So it's now my pleasure to invite Caroline and Joanne to join me for a partners discussion. Hi, thank you both for doing this. This is absolutely great.
You're welcome.
So I'm going to start off by asking you both if you could please tell us your first name and a little bit about yourselves, so such as your job, your hobbies, or your interests. Caroline, do you want to start?
Hi, so my name's Caroline Prance. I'm actually a retired nurse, a general and psychiatric nurse. I spent the majority of my career working in psychiatry. I've got lots and lots of interests. Since retirement, my particular love is creative writing, and I definitely found that the place where I can lose myself. I also love anything to do with the outdoors, amateur archaeology, travelling around in an old camper van, music, live music, and I have 4 grandchildren between the ages of 8 and 10, which keep me very active. And yeah, lots of things.
Sounds like you've got a really busy lifestyle, Caroline. Joanne, how about you? Yes.
Yes. Hi there. My name is Joanne Marston. I'm a supporter for FAB, which is Friends and Breadwin's Prostate Cancer Support Group. My husband is a co-founder and has been co-founder now for that group nearly 5 years. I have 2 individual jobs. The first job, I'm a teaching assistant for a primary school, and my second job, I am a Nottingham active host. I work for a leisure centre, and my love, my activities, I love swimming. I've just taken on swimming. I've been swimming for nearly a year now. Haven't got to the 64 length, which I'd like to do, but that is my goal at the moment. I love outdoors. I love gym. I love to go to classes. I have 3 children. The first one, he's 23, and I've got twins who are 21.
Fantastic. So you've both got really busy lifestyles and lots of interests, which is great. So if I can go on to now find out a little bit about your partners. So if you could tell us when your partners were diagnosed and what treatment or treatments they've had. Joanne, do you want to start with this one?
Yes, certainly. My partner was diagnosed when he was 45 years old, 14 years ago. That was 14th October 2009. The procedure which he had, which was a prostatectomy removal. So he was diagnosed in the early October, and then he had the prostatectomy at the end of October. It was a really quick procedure. Really quick procedure. I mean, at the time my children was very young, but it was done successfully.
Yeah, no, that's great. That must have been quite a shock for you to have it all done so quickly, though.
It was a real shock, definitely. Yeah. It was.
And Caroline?
Well, my partner was diagnosed in May 2018, and similar to you, Joanne, he also had a prostatectomy by robotic surgery. Yes, and as I say, as a retired nurse, even though when you're in the situation yourself, all your knowledge just goes, you just want to be a partner. It was a huge shock, because I was absolutely convinced, because he had no symptoms, just purely a little bit weeing a bit more, which it's quite normal for sort of men as they get older. So I just assumed that he would be having active surveillance, but to hear that no, he had to have treatment was a real shock to the pair of us.
I mean, hearing what you've said, I mean, Wayne's father, I mean, he was diagnosed with prostate cancer, so we knew he was hereditary. He died 1999, so he died 2 years prior when having the surgery. So it's all promptly went to have the PCR test and everything else involved with getting checked out and everything.
Yeah. So when you were both talking about your partner's diagnosis, did they have a choice of treatments, or were they kind of channeled into having a prostatectomy?
I mean, on my side, there was no choice at all. It was just, it happened, and that was the only choice at the moment. But again, research going forward, there's more research now, but at the time there wasn't any choices at all. And again, living with young children, it was just sort of like, it was just get the removal, so you're safe.
Yeah. Was that your experience, Caroline?
No, slightly different. We did, or my partner did have options, but unfortunately we received the news on the Wednesday and we were told, good news, you can see the surgeon and the radiographer on the Friday. And then we just had a 2-week period in which to make a decision, which was horrible.
Yeah.
Because, you know, you go from thinking, oh, it's fine, you'll be fine,
Yeah.
in a such a short space of time, and then having to make such a life-changing decision so quickly. But and it just felt a bit like sales talk, really. You know, this is what will happen if you have surgery. This is what you know, come to me, come to me. And he did opt for surgery because probably similar to your husband, Joanne, he just wanted it out. He wanted the cancer out.
Exactly, but it's not a long. It's only a short period, 2 weeks.
It was horrible.
Two weeks, and then you've got to remember as well. It's like you've got your own life to live. You're working, you've got your young children. You still have to live as well.
Yeah. I was just going to come on to that now. Thinking about your partner's diagnosis and treatment, what were your main challenges through those times? You know, in terms of work, your relationship. You talked about family life and maintaining your own social circles. How did you both cope with that?
I often think of it like a bereavement, actually. That's something that's come, you know, increasing, I think, if you think of the bereavement model. I retired the day before my partner got his diagnosis, and we'd been together sort of, you know, we'd known one another for a long time, but made the decision that we were actually going to live together. So that sort of, yeah, it was a real challenge, all of that. But I think it was talking to friends was okay. You know, lots of people know people that have had prostate cancer or got it, but I didn't actually know anybody that was living with a partner with prostate cancer, which was why we then went on. We joined a support group, and within that group, I set up a partner support group, and that was the turning point for me personally. Was meeting and talking to other partners. And I also have to say that we had the most phenomenal telephone conversation with one of the clinical nurse specialists from Prostate Cancer UK. We rang one day, we were just absolutely, so we just didn't know what to do. So we rang and had a joint phone call, and that was a massive turning point for us. She normalised, if you could, you know, she just made us feel that what we were feeling was almost, she was wonderful, absolutely wonderful.
What about you, Joanne? What were your main challenges?
Well, I mean, how can I describe it? It's like our relationship was like, we just became bubbles of love and hope and struggles and help, to be honest. I mean, we had no one to even speak to be honest. There was just like nobody there at all. I didn't tell my friends, because my friends had like young children, because at the time, I mean, my children were 7, I had twins, and then twins were 5. So our lifestyle was so busy at home, to be honest. It was just, where do we go? So I can remember walking around, sort of like trying to go to doctor surgeries, trying to look on the internet, and just trying to get some leaflets and just finding like anyone to talk to, and there was like no one to talk to. So I just sort of like, again, went on to, you know, reading the Bible, doing sporting activities, sporting challenges to help me with my well-being, to be honest. because there was, I couldn't understand there was nobody out there.
I was going to come on to that next. Thinking about those challenges in your own well-being and your emotional health, what helped you both to cope, or where or who did you go to find support?
Well, I guess for me personally, what really did help is that fortunately my partner is a talker, so we had lots and lots of good conversations. They weren't always the most cheerful of conversations, but I really, really valued the fact that we could be really open about things. On a personal level, I've got two wonderful sisters. They were just amazing. Friends were wonderful, but not any of them had had that lived experience. But I have to say, for me, it was finding the group of women and setting up the support group in Oxfordshire. That was amazing, just to sit and have coffee with people that, I don't know, to have, it sounds awful when you really, but to be able to sort of like just have a laugh about things that really aren't laughable about, but it just, they knew what, it shortcut everything, really. It was, and it continues to be that way.
Fantastic. How about you, Joanne?
I mean, now, again, I'm a supporter for the Fab Friends and Brethren, and again, they've really helped me a lot along my journey, to be honest. Just getting involved in the community, and I'm able to actually speak out more, to be honest. I mean, before I was silent. When the children were younger, and then it was just I didn't want to tell them, because I mean it was the first that I've heard of like prostate cancer. I mean, Wayne's father died, but I didn't educate myself. I was just unaware. But again, me and my husband and the children, we sort of like we grown together, and it was like a close net. It was amazing.
Yeah. No, that's great. It must be very difficult when you've got children as well in the
Definitely,
mix.
because everything's just so busy. I mean, that they don't understand. I mean, now, you know, they're older, 23 and 21. You know, we did explain when you was younger, even sort of like doing like the pickups and drop-offs. You know, we used to share that. It was just me, and at the time, I mean, I've been on both jobs for like 14 years. I've always worked. I've never been unemployed. So, working in establishment where it's a sports centre, that really helped me and the children and my husband as well. We was always doing like sporting activities and sporting challenges, and that really helped us a lot.
So first of all, I would say be brave, stop feeling guilty. I think that feeling that you know, it's your partner's cancer, and feeling, I can remember feeling awful that I felt that I wanted somebody to talk to as well. So I really think we need to stop feeling guilty and feel okay if you have a good old cry or get cross at times, and keep trying to talk to your man. Write things down. I think that was a real key thing for us. So we used to write questions down. We kept a diary, so we would write things down that we would take to hospital appointments, and then write down the responses. But I still think, and even, you know, as I was thinking about this today, I thought, and that's something that we could still continue to do, because sometimes writing it is almost easier than saying it. So I think that, and I think never be afraid to ask any questions, you know, using the adage, no question is a stupid question. Find a group if you can, and look for other partners that can support you. There are sort of obviously things online, and we've also, you know, the National Partner Support Group, that's an online meeting, and to really, really take care of yourself. You know, take time out for yourself and don't feel guilty. So
well-being is really important.
You can have a lot of fun as well.
Definitely,
because time does, things do pass.
I mean, mine's similar to yours, to be honest. I mean, both getting support before and after treatment. This includes information on sex and your relationship, healthy eating, maintaining a healthy lifestyle together. You know, where can you get support? I mean, being around women, I think that helps. You know, people who share similar experiences as well. And also, I think it's important that it affects women and children and families. Even though the men are affected, it's still a huge impact on women also. that's coming from myself. And a women's support group, help. It's like help can at times can be taken for granted, almost forgotten, I always feel. So sometimes even taken for granted, hence men are more focused on rather than women, and women need support more.
Okay, lovely. Well, thank you very much for that really excellent discussion. And hopefully that's been really valuable to other people who are currently supporting their partners. I'd like to just take a moment to tell you about a new resource that Prostate Cancer Research have launched earlier this year called the Info Pool. Now, this is a new website designed to support people affected by prostate cancer. And it's got a whole range of different features, including help in understanding treatment choices, finding information on clinical trials, and much, much more. And we're really pleased to have recently launched a new section just for partners and carers. And we've got some really good key resources on there, including partners groups. So as you'll see, we also have a story section on there where real people like Caroline and Joanne have shared their stories. So do go and check it out. And please do also consider sharing your story too. And that will really help others in the future learn from your experience. As Terry said, problem shared is a problem halved. So that's fantastic. Now we're going to move on to our final speaker. It's my pleasure to introduce Angela Gregory. So Angela is going to talk to us about the impact of prostate cancer on partners, a psychosexual perspective. So Angela, over to you.
Thank you. So good evening, everybody. And yeah, so I work as a psychosexual therapist in a busy NHS clinic, and I see men and women with a range of sexual problems. And I see quite a lot of men who have had or living with prostate cancer. So yes, that's what I'm going to be talking about. So next slide, please. And this is just disclosures and the first slide in the presentation. So I think it's really important because there's no such thing, in my opinion, as an uninvolved partner in a relationship where there is a cancer diagnosis or sexual issues with sexual function. Now, I will specifically, when I see people in my clinic, specifically men who are referred to our clinic, it can be quite often in relation to issues with erectile dysfunction, particularly if it's related to prostate cancer. Much as I enjoy working with men, they do have certain predictable behaviours in my experience in our clinical practice. And one of those is if they have erectile dysfunction, what can happen is they start to avoid being sexual with the partner because of the fear of failure and the impact that also has on their sense of self in terms of being a man. And what then happens between a couple, because then, you know, you have a partner that's worried about failure. If they're in a relationship, the partner might then feel hurt and rejected because they've tried to initiate, they've been rejected, or they don't want to start something because they don't want to put pressure on. So what starts as a sexual issue can then lead to a problem with intimacy and touch and affection because of not wanting to put pressure on or worrying about failure. And the longer that goes on, the more distance a couple can feel. So by the time I see people in clinic, it's often not unusual for them not to have had an intimate or sexual relationship for quite a long period of time. And then the other theme on top of that is the difficulties we can have in communication when we're talking about sensitive or emotional issues. So my job is really, you know, try to help a couple, and I always encourage a man to bring his partner in and to find out the impact the diagnosis and the impact of the sexual function and the loss of intimacy also has on the partner. Next slide, please. So let's just acknowledge talking about sex and intimacy is not easy. And it's because it's not just about the act of sex, it's about the emotions, and it's about how we feel about things. And even healthcare professionals, we're often doing lots of education with, you know, healthcare professionals that work in, urology, that work in any area where someone may have a cancer diagnosis, spinal cord injury. In my opinion, if you're a healthcare provider or clinician and you work in an area where the disease or the surgery can impact on sexual function, there should be an opportunity for a man or a woman and their partner to be able to discuss it. If you're trying to talk to your partner and it's difficult, sometimes even using something like this video or this presentation to try and start a dialogue can be helpful. Next slide, please. So speaking to your partner about sex, I know is difficult, but these are some of my suggestions. Is think about timing. Timing is important. If they're busy doing something, wait till there's a time that you feel that you've got some privacy. Acknowledge the issue. Think about being specific. Sometimes my parents have been married for 67 years. My mother still thinks my father should know what she means, and of course he doesn't. So sometimes being specific about what you miss or what you would like to do is really important. And I also think when we're talking about difficult issues, it's about avoiding you statements. If you say to somebody, you never talk to me, you never cuddle me, that in the way we express it can sound like we're blaming, and you're often not going to get a response from that, because what happens is we go on the defensive. You never do that. Well, I did last week. Or you never do something else. It's a circular argument that doesn't really go anywhere. So we talk a lot in therapy about using I statements. And the other thing, that list 5 things is something we do. We get couples to do this. Write down 5 things that you miss, 5 things that you would like to do, and then they do their own list, and then we share it and discuss it. Next slide, please. So acknowledge the problem. I know diagnosis and treatment had an impact on our relationship, but I miss being close to you. I know things are different, but I'd just like to lie in bed and have a cuddle. Think how different that sounds by saying, I would like to do that, rather than you don't do that. It sounds very different. Next slide, please. Could we start to rebuild things? One of the things we do in sex therapy is when we're negotiating with a couple about rebuilding their intimate or sexual life, we have very clear boundaries. And the reason for that is if you don't have a clear boundary about what to expect, you're almost trying to second guess what the other person might want. And if you're worried about failure and you don't know what the kissing and cuddling is going to lead to, you might not do the kissing and cuddling because you're worried about the outcome. So we often work with clear boundaries, but that is something you can do yourselves as well. Last few months have been difficult. I'd love it if we could have a date night, a date afternoon, anything, because when you're not intimate, whether that's sexual intimacy or general intimacy and affection, you don't produce oxytocin. Oxytocin is a chemical we produce when we're close, when we touch, when we kiss. It's like a bonding chemical. And that's, it's what we get when we hug children. We produce oxytocin. It makes us feel close. So often when there's a sexual problem, it impacts on intimacy. Couples have less affection. They maybe don't have fun anymore. Sometimes the starting point in sex therapy is more about the general relationship rather than what happens in the bedroom, because you have to have the foundations. Next slide, please. So some of the tips I would say is write down what you want to say. And I'm really glad that was mentioned earlier. And that doesn't matter whether you're writing down what you want to say to your partner or you're writing down what you want to say to the doctor. If you're nervous, say it out loud. You might feel ridiculous, but, it's worth a try. Give your partner a letter or a card. Something that they can go away and think about if you're struggling to express yourself. The other tip I would say is talking in a neutral place, particularly when you're walking, is really helpful because you're not looking directly at each other. Sometimes it's easier to talk about how you feel. And particularly I like driving because, you've got somebody contained. And find support for yourself, be kind to each other. And something I've just put here is understand your love language, which I'll just talk to you a bit in a moment with the next slide, please. So this is something you can find online. It's not very scientific. It's not very, it's just a way of trying to understand that sometimes we don't speak each other's love language. For example, if your partner, their love language is acts of service, so they like doing things and they think by doing things you'll feel loved. But for you, your love language is physical touch. But because of what happens, your partner no longer touches you in the same way. So by looking at this quiz, it's just a really nice way of trying to think, what is our love language? Are we not, are we crossing in terms of our communication because we're not understanding how we need to feel love and to show it? So you can find that online, www.5lovelanguages.com. Next slide, please. So erectile dysfunction, I've put this on this, and I know it's about partners, but I do think over the 24 years I've been sat talking with men about erection, I do think men and their partners are badly let down by the information that they're given in terms of treatment options. When you've had a disease or surgery that has an impact on your erections, you're not talking about a few tablets and then go and have sex. What you're thinking about is penile rehabilitation. It's not, if you've not had an erection for 3 years, if you've not had any erection, nighttime erections, you can't just take a few tablets and expect to resolve. It's a body part that's not getting the blood flow it needs. So we often encourage men and their partners to think about it in terms of penile rehab, taking the medication regularly, or if the medication isn't going to have a positive effect, using the pump, but using the pump daily as an exerciser, because it's all about blood flow. It's all about helping the endothelial function of the penile tissue. And of course, men can go through all these treatment options, but some of them really benefit from an implant, and that can have a really positive impact on confidence. If you've had surgery or medication and you're older, you've had medication, you've had surgery, you might need more direct stimulation to the penis to help with that erectile response. Pelvic floor exercises for men and women, we always recommend. And don't be put off if your GP only gives you 4 tablets a month. Make sure we always ask for 8 tablets. And we always suggest that the longer acting tablets allow for more spontaneity. And that can be really helpful for a female partner in terms of them also getting in the mood. So next slide, please. Now, this is quite a medical slide, but I didn't put it on for the, we know that there are different levels of, not everybody responds to the tablets, and that's what the PD5 inhibitors are. Some of the reason for that is the damage done by the surgery or treatment, but high levels of anxiety can also affect the success of the medication, but it can also affect the pro-erectile action of the drug. So anything that can help a couple or a man calm down, feel more relaxed, clear boundaries, lots of nice touching, the more you can reduce any sort of stress and anxiety, the better the response will be. Next slide, please. This is just to illustrate the point before about anxiety. When we have lots of negative thoughts, that produces a stress response. We produce adrenaline, and that adrenaline will help contract the smooth muscle of the penile tissue. So it's really important that the more, as men and women, the more relaxed we are, the better our arousal will be, whether that's physical arousal or psychological. Next slide, please. So it's very common that female partners of a man with erectile dysfunction can have a decrease in sexual interest, reduced frequency of orgasm. Now that can be because sex has become awkward. It's not relaxed, we feel self-conscious, therefore it affects a woman's ability to get aroused. But it can also be if the woman is postmenopausal, when you go through the menopause and you have changes in estrogen levels, the tissue in the vagina can get thinner, more prone to abrasions. So you need to think about, using a good lubricant. Lubricants are for something going in the vagina. Moisturizers are something that you put on generally, like you would moisturize the rest of your body to keep the tissue in the vulva and the vagina healthy. HRT, systemic, means you take the tablet, gels or patch, it's in your whole system, but you can get local estrogen treatment that you put in the vagina to keep the tissue healthy. You can get a clitoral pump, like you can get a vacuum device for the penis to help with engorgement of the clitoris. Of course, pelvic floor exercises are helpful. And if you are menopausal, I've strongly advise you to check out the Balanced Menopause website and app, which is excellent in terms of information and advice. Next and final slide, please. So finally, issues with sex and intimacy can be more difficult because it involves two people. Well, sometimes maybe even more, but in general, most relationships that I would see in clinic involve two people, two sets of emotions, two sets of feelings, two separate experiences. And that's what you're trying to work with to help the couple move forward. Some couples do need to see a therapist or a counsellor. And you speak to I'd say speak to your GP, find out if there are any local services, and if not, you can look at Relate, and you can look at my professional body, which is COSRA, the College of Relationship and Sexual Therapy, list of private therapists, but also they have some really good tips and hints on how to resolve some sexual issues. And that's my final slide, so thank you.
That's great. Thank you, Angela. That was really fascinating. So now I'm pleased to open the floor up to your questions. Somebody has asked, how do you deal with the anger and depression of your partner, which is often directed at you as a carer because you're the only one where he can actually be himself?
I mean, I would say it's normal. Anger can be a normal feeling. Usually underneath anger, there's sadness, frustration. You know, there's usually another feeling underneath anger. And I suppose I think it's acknowledging that the person has the right to feel angry, but could someone help suggest maybe a more productive way for that person to express their anger, so it's not primarily directed at their partner, who is their significant other. And I think that's somewhere where someone needs some sort of counselling.
Yeah.
So they've got an outlet that's not about their partner. The partner has some space, but the anger, they need some expression.
Lovely, thank you. And somebody has asked here, their husband has had cancer 3 times over the past 30 years, starting from age 29, and they've always found there's limited support in getting life back on track, like playing rugby, riding a bike, having sex, etc., which has mental health implications. So you become a cancer patient rather than a person with needs. And she asked, do you think there will be a change in the future? Can we get better signposting in the future? If anybody, maybe Terry or one of our partners, would like to answer that. How do we feel about signposting?
Personally, I think signposting is really, really important. You know, and sharing of information, which is, I mean, I think back to when I first met you, for example, Terry, I think of how awareness about the impact on partners has grown so much in that short period of time. And I think the more people that are aware and share information, whatever way they do that, it's just so important. Yeah.
On a positive note,
yeah.
in Nottingham, no, not everybody is going to have this experience, but in Nottingham, they've just extended their clinical psychology services from 1 member of staff to 6 clinical psychologists, and each clinical psychologist has a specific responsibility for a certain cancer area.
That's wonderful.
That's amazing.
Yeah, that's great. And question here now for Terry. Somebody has asked, how many women were involved in the survey or in your study?
We only had 26 women involved in the study, and they came from Red Cross the UK, except for Wales. So we had women from Northern Ireland, Scotland and England, and for some reason we didn't have any uptake in Wales, despite trying numerous avenues there. So although there were only 26, it was because we weren't asking specific questions of them. We weren't imposing our thoughts of what the question should be. We were letting them raise issues. So some of the interviews were really quite long and quite involved in doing the analysis of what was going on. So it would be nice now to see a wider survey maybe going on with the things that we've already learned from there, that we could put it out to a wider range of people.
Fantastic. Thank you for that, Terry. Somebody else has asked here, her husband has been diagnosed with prostate cancer. He's 53, Gleason 9, stage 4 prostate cancer. And she just asks, how do you learn to live when your life has been turned upside down? And this might be one for our partners, perhaps.
Again, just be positive. Be positive. There's always a light at the end of the tunnel. Just work together, stay together. Just look for like different organisations. Just keep yourself busy, and it's again, just take care of your well-being. We only have one body, and just take care of your well-being.
It's hugely difficult, isn't it? Because it seems to be divided. I think we might say that having partners who've had prostatectomies, the treatment that they had is actually quite different to partners who have been diagnosed, particularly at such a young age, with advanced prostate cancer. And I would absolutely encourage you to reach out. I know I've mentioned Prostate Cancer UK before, but they've got such a wonderful website with so much information, and the clinical nurse specialists, they are experts in talking with and then directing them on to volunteers who have, who've lived similar experiences. So reach out, again, see your GP, talk to the hospital, reach out to Macmillan rather. There's lots and lots of services around. Spend a bit of time doing a bit of research.
I mean, group talking out really helps. It does, rather than being silent. Definitely.
Excellent, thank you. And we have a lot of questions actually about support groups and how can people best find out where to find a support group in their area. Caroline, can you help us with that?
Yeah, I mean, again, if you go onto the Tackle website, they've got a list of all the support groups that are in the UK. I think also Prostate Cancer UK still have Tackle has taken over from Prostate Cancer UK with the support group side of it. So, check out those websites, look at Prostate Cancer UK as well, and certainly they can direct you to the national partners support group, the online group.
Excellent.
So, yeah,
that's great. Thank you. One for you now, Angela. Lady here saying she's struggling with her husband's total loss of sexual interest. He's on hormone injections, has stage 4 since initial diagnosis 3 years ago. So he just doesn't show an interest at all. Is there anything, she's feeling really despondent about this. Is there any advice you can give to her?
Well, I suppose it would be, as he just, I know the hormone treatment can have a hugely negative impact on libido. And I do think it's really difficult because some men, if they don't feel those feelings that they used to have, they sort of shut down. I suppose would there be any way of talking to him about what she misses, even if it's just in a general sense, in terms of, the cuddling or some sort of general intimacy. For some men, if the penis doesn't work, they don't get those feelings, they don't want to do anything. So it's whether or not she could have a conversation about, she might just miss, whether she's missing a cuddle or whether it's something sexual. I think the impact of those hormones for some men is it just shuts down everything, and they can be quite low in mood as well, which also doesn't help your interest. So I think it's having to have a conversation.
Yes, yeah. Another kind of related question here is about intimacy. Yeah. How do you cope with a partner who will not talk about intimacy when he's fought cancer for 6 years and is now in remission?
I know it's just really difficult if you have a partner that you can't talk to or who won't talk. I don't know. I mean, that's why I said sometimes you are limited in some ways, dependent on the relationship with you have with your partner or your partner's, way of dealing with difficult things. If they just completely withdraw, do you keep chipping away to try and have that conversation? But you end up feeling quite hurt and resentful yourself because you feel like you're making all the effort and you're not getting anything back. But I don't see how you could sort of move forward unless you can sort of maybe put on the table directly what it is you need.
Yeah.
It's really difficult when you've got partners that just won't talk. You're gonna, in some ways, you've got to find some sort of support outside of the relationship, haven't you, to be able to you know, to be able to talk about your own feelings. You know, if your partner won't listen to you and won't touch you, you're going to feel really isolated in that relationship.
But I think it's a good idea. I think it's a good idea what you said. I mean, rather than sort of like sitting down in the living room and you've got the chair like next to each other, again, as you said, going for walks so you haven't got the eye contact, doing an activity, just showing, just even if it's sort of like it's a short sort of like conversation rather than a deep conversation. I mean, it could even be like one conversation sort of like once a day or once a week, rather than bombarding with like loads and loads and loads of questions. That sometimes does help. It's helped me, rather than I've got 10 questions, but I wouldn't ask him 10 questions in that one day. I'll spread it out.
Yeah, and I think sometimes when I see people, you can't really necessarily work on the sexual side because that couple's not doing anything together. So I think sometimes maybe rather than talking directly about intimacy or sex, maybe sort of saying, can we go to the cinema? Would you like to go to the cinema next week? Or I'd really like to go swimming, or can we go? Do you know what I mean? Something that you start doing something together.
Yeah.
Because it might
definitely
be too far away in terms of the sexual and intimate side because you feel so distant. But you can make a start on maybe something that feels less emotive and threatening.
Okay.
And so, as you said, there are some of the ladies, some of the men just will not engage.
I know.
The ladies in the survey that I interviewed, some of them really find help just through talking to either counsellors themselves. No, fine, rightly that their other half wouldn't go to the counsellor, but at least they were able to talk to the counsellor and get some relief. Just get it out there.
Yeah.
And
because otherwise you're
holding the other women,
aren't you?
So thank you again to our speakers, and thank you to all of you for joining us.